Dr. White, thanks for continuing our conversation. We want to know a little bit more about adult vaccinations. I don't get shots anymore very often. We'll talk about one of them I got, but just because we got shots as babies and children doesn't mean they're over. There's great reasons to consult your doctor about vaccinations that we all need at any age. Is that right?
Absolutely.
What are some of the most common ones?
Well, the ones that we give at all ages are the tetanus and diphtheria vaccines. We give them every 10 years, no matter how old you are. And once in adulthood, you also need to add a whooping cough to that vaccine because it protects you from giving whooping cough to little tiny babies who haven't been immunized yet.
Is this relatively new that you're giving vaccinations to adults, or if we'd been paying attention and consulting our physicians, we should have been getting these adult vaccinations all along? We should be on some kind of a schedule, right?
We should be on a schedule, and our electronic health records in general do remind us of when we need to give immunizations to our patients. Some things we've been doing all along, like a tetanus and diphtheria booster every 10 years. I learned that in medical school, but the extra shot of whooping cough is something we just added in the past few years because we were having whooping cough outbreaks. And this is to protect other people that are either not immunized or not fully immunized.
So I could spread whooping cough without actually having it? I could carry it? Is that what you're saying?
Well, you don't really carry it, but adults tend to get a very mild case of whooping cough, and they might just mistake it for a cold. But if they gave it to a baby who didn't get their shots yet or didn't have the full series, or if they gave it to someone who couldn't have shots, a small child who was immunosuppressed for whatever reason, then they could get a really bad case of whooping cough.
In the presentation you did on television, you mentioned a vaccine that I think was the most expensive vaccine I've ever had, and that was for shingles. Friends of mine who had shingles described it to me, and I was ready to pay whatever the price was to get that. And you think that's a great idea too, because you've suffered from shingles.
Right. I think a shingles shot is a great idea. It's recommended over the age of 50. Most health plans don't pay for it till 60, so I do recommend it at the age of 60. Shingles is a horrible, horrible disease. You have to have had chickenpox first, though. Most of us get it in childhood. We're immunizing our children now. We've been doing that for the past at least 20 years against chickenpox. So we don't think that they'll be getting shingles, but those of us who are older who had chickenpox when we were kids, we're at risk for getting shingles as we get older.
If you could verify that you never had chickenpox, it's not likely you'd get shingles, but if I was your patient, would you say, go ahead and get the vaccination anyway as a precaution?
I'd probably have them get the chickenpox vaccine instead.
Oh.
Because we could check your blood to see if you were immune to chickenpox.
Okay.
Because we wouldn't want you to get chickenpox. For instance, if you were a woman of childbearing age, we wouldn't want you to get that and while you were pregnant.
I think my shingle shot cost like $400 or something. It wasn't cheap. Whatever it was, $300 or $400. Why is it so much more expensive than a regular shot of something else?
Well, that I don't know. I think it's about $200 though.
Okay.
It's still much more expensive than the other ones, but it hasn't been around all that long.
I probably went to the wrong guy, maybe.
Well, it should be covered. In fact, we send our patients to a pharmacy rather than stocking it here, and that way the pharmacist has instant access to see whether it's covered so that the patient can make a decision, well, do I really want to spend $200
Yeah.
or wait until it's covered by another insurance plan?
Every year, in the fall of the year and into the winter, the topic of flu shots comes up and people go, I got a flu shot once and I got the flu and I'll never get one again. I understand there's no scientific basis for that. Your thoughts about the flu shot?
Right. I think everybody should get a flu shot unless they have a severe anaphylactic reaction to eggs in which it's grown, or they're immunocompromised and they can't get live vaccines. So everyone else should get a flu shot if they're 6 months of age or older, and that includes pregnant women. Everybody should get one because that'll keep you from spreading it to somebody else. If you don't get a flu shot and you get the flu, you can spread it to someone else, and maybe you're 25 years old and you don't get that sick, but you give it to your great-grandmother who's 90 and she can die from the flu. Little teeny kids and older people, the very old, tend to die from the flu.
And you don't get the flu from a flu shot. It's just
you don't
no
get the
science
flu.
for that.
No, you might get a tiny, tiny reaction, but you're not going to get the flu.
Very good. For those, many of us are blessed to have a physician we've gone to for a long time. We're blessed, fortunate to have insurance. For people that are watching you right now that may not have access to medicine, where can they go for some, I'm especially thinking of elderly, lower income people. They can usually find clinics and catch up on vaccines. What guidance would you give them?
There are clinics where you can go and get shots. There are state health departments, I think. I
Yeah,
haven't
and
been here
county
long
health-
enough.
well, and county health departments too.
Where you can get immunizations. You also can look into medical assistance to see if you qualify for that. There are some places that will treat patients for free depending on their income level. We have that service here where you can be seen for free for a certain number of visits because you just don't have the money to pay for health insurance.
I sometimes tell people, if you don't know who to call for some medical help, call the guy you voted for, your city council member, your county commissioner, and just ask them to give you some guidance. An elected official can certainly point anyone in the right direction to get some help with medical.
Right, or call the University Medical Center. We'll help.
Very good. Thank you so much, Dr. White. We
You're
appreciate
welcome.
your time.
My pleasure.